Hello, and so this is my major and career project or presentation, and it is by Kourtni Price. So that is me. So I'm taking a little bit of a different approach because I am not a psychology major and I actually graduate this semester. So I am just going to go over my degree and career, and then also what I hope to become after I graduate in a couple weeks. So I'm a public health major, but I really want to go into epidemiology. And so what epidemiology is, an epidemiologist studies the cause and disease and other types of serious health problems in public and works towards stopping and or preventing them from outbreak. So specifically what I want to do, um, I'd like to work in the epidemiology field in infection control as a specialist or as part of a team. And so I'm just going to use a hospital, for example. Infection control specialists in hospital, they protect patients and coworkers from the spread of communicable diseases. If there is an outbreak, they attempt to determine the source of the infection. So where the disease is coming from and how fast it's spreading, how to prevent it, what precautions patients, coworkers, anyone who enters the hospital needs to take to protect themselves. Together as a team, they are responsible for prevention, investigation, monitoring, and reporting the disease outbreak to the public so everybody has knowledge of it and to be cautious of it. So the required education for that. So to work directly under an epidemiologist or on a team, it's just a bachelor's degree. So 4 years of schooling. Specifically, they look for classes such as biostats, community health modules, and that is promotion, implementation, evaluation, and epidemiology classes. So those are classes that are definitely needed to work in this career field. Um, and so with my degree, I'm able to work on a team and maybe with years and experience, even become a specialist in it. Working directly under an epidemiologist to assist in surveillance, research, study, reporting, etc. Kind of everything I talked about in the previous slide is everything that I would be capable to do with my current degree. And as I have been job searching this past semester, I have found that lots of businesses will accept a bachelor's degree with 5 years plus experience, and they will take that as the equivalent of an actual epidemiologist, so a master's degree level. And then to get your master's degree level, it's 2 additional years in a related field of public health. And usually it is either in epidemiology or biostatistics. So completing my 4-year plan. So I obviously did my 4-year plan 4 years ago, and now I am finally completing it. But it helped me a lot throughout my schooling in several ways, and these are just a couple of the ways that it's helped me. So it's helped me stay on schedule. And by that, I mean, I knew what classes to take. I knew how big of a course load I needed to take. And I had everything planned out each semester. It's also helped me prepare for future jobs because this career just isn't, or this degree doesn't just go into epidemiology. I can go into public health admin or public health education, epidemiology. There's a broad range of things, and so it's helped me prepare for future jobs and what I might be interested in. It's helped me decide what field of public health I am interested in. Currently, I am doing my internship, and that is in public health admin, and it's been a really good internship, but it's not necessarily what I want to pursue after I graduate. I enjoy it, but I feel that I would be more interested in epidemiology more, working in that. But being able to complete my 4-year plan, it's given me the training and skills that will help me in the career of my choice, and it's actually helped me finish school. So I think because I had that plan in place and I knew what I was supposed to be doing every semester and working for it, it was kind of that finishing push to help me complete school. Because there were several times that I wanted to quit school for a semester. I had a baby, I got married, we moved a couple times, And so every time I'm like, I just can't juggle school. But because I had that 4-year plan and I knew exactly what I needed to do to complete it on time, that was really my motivating factor for finishing school. And I'm really grateful I stuck with that. So, how I chose my major, this major kind of just ended up in my lap. I always knew I wanted to do something in the health or medicine field. But after moving away from Idaho, getting married, and like I said, we got married, had a baby, moved a couple times. It was just hard to stay in a school. I couldn't just keep enrolling into a whatever college town I was in. And so I chose to become an online student, but that really limited my choices in health and medicine field degrees. But they had the public health degree, so I decided to just go with it. And I'm really grateful I stuck with it because I didn't really know what public health was. And it's given me a broad spectrum of jobs that I'm able to choose from or work in after graduation or even years down because I got a lot of experience in um, a couple different sections of this field. I definitely became more interested in it as schooling went on, as I took classes. Um, that's kind of how I've learned what fascinates me. I never knew what epidemiology was until I had to take the class epidemiology. I had looked into a little bit, but I didn't know what it really was. And once I took that class, I totally fell in love with the career and everything about it. And so that's kind of helped me choose my major. Um, and so that helped a lot is taking the different classes. I learned what I was interested in, what fascinated me, and what didn't so much. And that is the end of my slideshow. How do I stop sharing?